Do you ever ask yourself, should I care that the FDA released a new food pyramid? Hi. Now, the food pyramid is a visual representation of what the Food and Drug Administration, I assume in consultation with other government agencies and departments, and perhaps colleges and universities, recommends our dietary intake should be for best national health. There are differences in this edition of the food pyramid from previous visual representations, whether food plates or food pyramids. For me, the headline of this recommended diet is the prevailing message for all of us to eat more real foods, whole, nutrient-dense foods. We should increase our intake of protein from animal and plant sources, consume full fat dairy and other fatty foods, and reduce our intakes of carbohydrates. This food pyramid reduces the emphasis previously placed on lowering saturated fats and lowers somewhat without removing recommendations for our intake of vegetables and fruits. Now, this message of eating a balanced diet of real food without being unduly concerned about saturated fat intuitively makes sense to me. I'm sure there is sufficient science and data to back up these findings, right? So I support a plan and applaud the FDA and HHS for publishing this new food pyramid, but I have a concern. It is not based on science. My concern is based on my observation of communities where I now live and in Washington, D.C. and the Northeast where I lived for 19 years. My concern is the prevalence in these areas and across the country of food deserts. There are urban and suburban and rural food deserts. They are pretty much the same, though their causes may be different area to area. According to the U.S. Department of Agriculture, a food desert is any region, urban, suburban, or rural, where residents have limited access to affordable, healthy foods, especially protein, fats, fresh fruits, and fresh vegetables. Recent estimates suggest that nearly 19 million of us, people in the United States, live in food deserts. That is about 5.5% of the population, more than 1 in 20. There is a strong correlation between food deserts and income. So it is reasonable to imply that food deserts affect the poorest parts of our population the most. A clear, visible indication of a food desert is the absence of local, nearby, and easily accessible and well-stocked supermarkets like Safeway or Food Lion or Piggly Wiggly or Giant. What remain in these food desert areas are convenience stores with more processed foods than whole foods. So my concern about the new food pyramid is that if you live in a food desert, these new recommendations may be unachievable. The people living in food deserts, areas with this limited access to healthy food options, already suffer from higher rates of obesity, diabetes, heart disease, and other chronic conditions, and higher infant and maternal mortality rates. This new food pyramid likely may not make things worse, but unless there is an accompanying programmatic effort to change the status quo, the real impact may be to widen the already staggering dietary health gap between the haves and the have-nots. A program to get rid of food deserts would have to be both huge and tailored to local needs. It would have to be a public-private partnership, and it would have to be bipartisan and cross all racial, ethnic, and religious lines. Now, some say a program to eliminate food deserts would need to provide financial incentives for healthy food retailers to move back into the food desert areas. Support for mobile markets and community gardens. Zoning and legislative reforms to help assure the security and profitability of the resulting revitalized food market areas. Improved transportation and delivery options, which could be a huge effort. Subsidies and affordability programs to assure these new market areas succeed, and nutrition education and community engagement. So I support the new food pyramid and applaud the FDA and HHS for publishing a pyramid that increases the recommended allowance of protein and animal fat, sustains guidance on the intake of fruit and green vegetables, and lowers the daily allowance of bread and other carbohydrates. But I have this concern. Unless there is an accompanying programmatic effort to change the status quo, the impacts may only widen the dietary health gap between the haves and the have-nots. Aloha.